Welcome to the Point, a series of brief trainings on insulin injection safety and diabetes care for hospitals and long-term care facilities, brought to you by BD. We know you're busy, so we'll get right to the point. Because insulin injections require the use of sharps, they may put healthcare workers at risk for a needle stick injury, or NSI. The Centers for Disease Control and Prevention, or CDC, estimates that hospital workers suffer 385,000 needle sticks and sharps-related injuries every year, according to a 2008 study. That's potentially more than 1,000 NSIs per day. Many more NSIs occur in other healthcare settings, such as nursing homes, clinics, emergency care services, and private homes. According to 2019 data from the International Safety Center on Needle Stick and Sharp Object Injuries, which assessed healthcare worker injury records at 36 U.S. hospitals, about 20% of the NSIs involve a disposable syringe. About 18% of those disposable syringes were used for insulin injection. Exposure to blood-borne pathogens from NSIs can be a serious problem for healthcare workers. More than 20 blood-borne infections may be transmitted by NSIs. Although relatively rare, some NSIs can result in serious infections, such as human immunodeficiency virus, or HIV, hepatitis B, and hepatitis C. Consequently, after any NSI, the injured healthcare worker will require testing for infection. The patient who was injected will also need testing. In addition, the psychological and emotional effect of an NSI on a healthcare worker can be substantial. To help reduce the risk of NSIs, you should follow the safety protocols of your facility for injecting insulin. In addition, clinical recommendations call for the first-line use of safety injection devices if injections are given by a third party. Standard education, along with the use of safety insulin devices and device training, is associated with lower risk for NSI compared to standard education with conventional insulin needles. To help minimize the risk of NSI through a skin fold during third-party injection of insulin, the use of a 6mm safety insulin syringe or a 5mm safety insulin pen needle without a pinch-up is recommended. More than 25% of all needle stick injuries occur after the injection, so safe disposal is critical to prevent injury. Sharps containers should be easily accessible at the point of care before the injection. So, what's the key point of this To The Point video? Needle stick injuries can be a serious problem for healthcare workers. Safety injection devices, along with their safe disposal, can lower a healthcare worker's risk of an NSI.